Good afternoon, everyone. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions and addresses the latest COVID news every Tuesday and Thursday right here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer questions and addressing the latest headlines through today, the 31st of March. And we invite you to continue to submit your questions to us via email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Sophie Biskowski, who is our Student Research Assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Good morning.
Now for some updated COVID statistics. In the United States, 66% of individuals are fully vaccinated. That is not with the booster, that is a two-shot process. And we are having a little bit of an uptake in cases, as yesterday in the United States, we had 49,531 new positive cases. Our 7-day average is still 27,621. So hopefully they continue to decrease in the next couple of days. The booster shot rate is still 29.6%. Hospitalization and deaths have both decreased. And in Illinois, we are seeing about a 4% increase in cases over the last couple of days, and our death and hospitalization rate are both decreasing. Dr. Murphy, as these numbers are like slightly increasing, decreasing a little bit, can you tell us about the fact that you have tested positive for COVID last week and a little bit of your experience?
COVID has not gone away. As you said, the numbers are down, but they're down from astronomically high amounts. And they're going up a little bit. Now, the whole pandemic is still coming down, but you're seeing upticks. We don't expect them, to be, that it's not going to be another Omicron spike. Most of this now is this stealth variant, BA.2. That's accounting for a lot of it. It's happening in Europe. Other parts of the world, and it's started happening here. The last I heard in the United States, the proportion of people testing positive was about 1/3 had this new variant, which is more contagious than the original Omicron by some 30 to 50%, very highly contagious. So as you mentioned, and I think a lot of people know, I got infected about a week ago. I had dinner with a friend of mine who had just returned from Europe, had a negative test the day before the flight, and arrived. The next day was the day we had the dinner, and everything was fine. And this person calls me and said, "Oh, I'm really sick," and did some rapid tests, negative. And I said, if you're still sick, go to an urgent care place and find out if you have the flu. There's a big uptick in flu right now, flu A and B. There's other things that can cause respiratory illness. So they went to one of those urgent care places, had all that, including a PCR for COVID, which was positive, but they found out the next day. So that night, which was Friday, so 7 days ago, that person tested positive on the rapid test. So I had done a rapid test on Wednesday, negative, and I felt fine. Friday, I still felt fine, but my rapid test, and I did 3 of them, were positive on Friday night. So, and I felt completely fine. I said, oh, I'm vaccinated. Maybe this is just gonna be a big nothing. Well, the next day I started to feel sick and, had a cough and sore throat. And I got terrible laryngitis. I don't know, I had a WGN radio show Sunday and a lot of people said, you don't sound right. Well, I didn't sound right for a good reason. And then I had, really a lot of cough. I never had a fever, very strange, but I was really coughing. I'm still coughing a little bit. I'm in isolation. I'm not going out anywhere or anything like that. I'm just staying at home. But I'm staying away from people and just coughing a lot. But yeah, this was a little bit more than I had expected it to be, because now I'm positive for 7 days and I still have a cough and whatever. So I'll just stay in isolation until all my symptoms are gone.
Well, that's really unfortunate to hear, Dr. Murphy, and we're hoping that you recover soon and can get out of quarantine ASAP.
Yeah. So, I mean, it's not the end of the world, but this is not a cold.
Right.
I've had a lot of colds before, with the runny nose and sore throat. This was definitely just not a cold. This was something different.
Absolutely.
Something worse. I'm glad I'm vaccinated, immunized. I didn't end up requiring any care. Oh, except I went because I do qualify due to my age to get Paxlovid or Molnupiravir. Paxlovid is much superior, and I highly recommend that one over the Merck one. And that was a journey in itself. It turns out they have enough pills for everyone that's eligible. So to be eligible, you have to follow the CDC guidelines for high risk. So high risk in the guidelines is 65 and over, or if you have any one of, dozens of different conditions, including being overweight. And the overweight that the CDC defines is pretty strict. So a lot of people are going to qualify for that one. But I mean, there are so many conditions up there. I don't have time to go over each one, but I mean, you can Google CDC high risk COVID, and you'll get this big list. So all those people are eligible. So, excuse me, a lot of people are eligible. The problem is they have enough pills for the people who are sick, but they don't have enough pills today anyway to stock all the pharmacies. So it's this crazy game you have to play. Where's the pills today? So there's a hotline number you can call for Pfizer, and Walgreens and CVS they're somewhat helpful, but the most helpful was the company one. And they know where the pills are. And so last Saturday when I went to get them, they sent me to Canaryville, 4700 South Halsted. Nice little journey down. I live on Halsted Street, so I live on North Halsted. So I just drove down Halsted. Very interesting ride, and there's a nice Walgreens down there with a little shopping center, and yeah, they're very pleasant and just handed over the drugs. And then the next day, a friend of mine also got diagnosed, a person over 65 years of age, with some minor medical conditions, but would qualify as high risk just for those, but by age they qualified. So I went through the whole process with that person, and they ended up going to 5600 West Fullerton. So it is a little bit insane, and you have to be able to play the game of getting to the pharmacy that has it. I did this a couple weeks ago for a patient who lived out in the suburbs, and the patient had called like 20 pharmacies. And I don't know if that central number had been operational at that particular time, but she did find a place and went and got it. So, I mean, it's an unfortunate game. Now, in this new plan that the White House has distributed, supposedly the pharmacists are going to have a lot of power in giving the medicine immediately to the people. I don't know if they're going to have a doctor's order or not. So that's kind of, right now you need a prescription, you need a doctor to call it in. But I think that actually even may get streamlined so the pharmacist can just give it away, which is the way it should be, because unfortunately with this drug, you've got to take it within the first 5 days of your symptoms. So that's how it works the best. So that's the game plan with Paxlovid.
Well, thank you, Dr. Murphy. We're now going to go into some headlines. The first headline is, what's behind the disparity in COVID deaths for Native Americans? Can you tell us a little bit about these findings?
Yeah, no, this is not new, but it's distressing that many underprivileged communities and communities that are isolated from big urban areas are having problems still with COVID. I mean, first it was African Americans and Hispanics and Native Americans, and their issues can be addressed, and it's obvious now that the Native American issues are not being addressed strongly enough. In the Hispanic community, the whatever was done in that group actually worked quite well. Just expanding access and making vaccines easier and have everything in Spanish and whatever. This is it worked. Within the African American community, it also worked. It worked pretty well too. These kind of interactions on the public level, they're effective. I don't know what's happening actually with the Native American one. Why it's so sluggish? It has not as improved as much.
And our next big COVID headline is the United States are closing their mass testing and vaccination sites. As I just said in the statistics, we are reached 50,000 positive, almost 50,000 positive cases yesterday. Why would we be diminishing mass testing and vaccination sites?
Because people aren't going. They're just sitting there waiting for people to show up. You can have these mass testing and vaccination sites, but people have to utilize them. And the vaccination rate, as you mentioned, I think already, not very high now. People have said, oh, I'm done with COVID. COVID is not done with us.
Right. No, absolutely. And for another big COVID headline is Hong Kong is running low on coffins amid its deadliest COVID wave. What can you tell us about what's happening in Hong Kong?
The Hong Kong lesson is very sobering. So in Hong Kong, it's different than many other population groups around the world. Around the world, typically the elderly people were the first in line to get the vaccine, and they're the highest vaccinated. In Hong Kong, it's other way around. The younger people are getting vaccinated, and the older people, was only about a 40% uptake of the vaccine. So these people are, at very high risk for severe disease. And guess what? Now that they're having this huge outbreak of Omicron in Hong Kong, guess who's dying? It's the older people, and they're under-vaccinated, and they're in a very congested city, urban situation. Hong Kong, very packed with people. And their mortality rate is just sky high. I mean, they are running out of coffins and, body bags. And, things like that. It's really, really terrible. Hong Kong is one of the wealthiest cities in the world. And there's really no reason for this except for their unvaccinated status.
Yeah, absolutely. And now for our last big COVID headline, the Biden administration is planning to offer a second booster shot to those 50 and up. What can you tell us about what this is going to look like and the potential FDA approval of this?
Well, if you remember, Sophie, about 2 weeks ago, we were talking about this. And the plan was that, first of all, Pfizer submitted their application to give a booster to people at high risk. And they kind of focused on the highest risk people, older people with underlying risk factors. Moderna came like a week or two later and said, we're applying, anybody can take it. Anybody who's eligible to take a vaccine can take it. So those are the two different philosophies out there. So the meeting that was supposed to happen with their advisory committees was supposed to be on April 6th. That was what the old press release said. And then on Tuesday, on the 29th, they say, okay, 50 and over, which was never mentioned in any of those applications. 50 and over, or you're high risk, get a booster. And that's based, now they're believing the Israeli data. Okay, the Israelis have the same issue, and they're a couple weeks, as we've mentioned in the past, ahead of us. And so they've been giving those shots out. So anyway, apparently they just made up their mind, and they're not waiting for that committee to tell them it's okay. This may be a good thing because it's going to speed things around, and we don't have to wait for committee, the FDA committee to send it to the CDC committee, and then, the two directors, slug it out. Fortunately, those days are over as far as this booster is concerned. Now, this is the same shot as before. They are both testing a new version of the vaccine head on. And so we'll see about that. But if you are eligible for a fourth booster, we know that these vaccines, that the effect does wane. And it obviously, like in my case, it doesn't stop you from getting infected. But, I didn't end up in the hospital. And that's great. Yeah, if you're eligible for a vaccine, the second booster now, go ahead and get it. This is what the new COVID is going to be. Waves of infection, vaccine boosters, whether it's going to be once a year or every 6 months or whatever it's going to be. This thing is such a strange disease. It's not seasonal. We had the Delta wave started in August last year. And then right at the end of Delta, we had Omicron, which started in January in South Africa, which is their summer. So it's not a seasonal thing, and it's so highly contagious. It's almost as contagious as measles. Very, very contagious disease. So that's if you're eligible, you should be taking the booster.
Absolutely.
Second booster.
And now for some COVID questions. In your podcast, you spoke about the Pfizer recommending a fourth vaccine dose, as we just talked about. I am concerned for two of my adult children who had immune system reactions to the booster. This was treated by multiple antihistamine prescriptions over many weeks now. Over time, their symptoms have been mostly subsided, possibly because their immunity is lessening. Their doctors believe that they had built a strong immunity in shot 1 and shot 2, and then when given the booster, it took them over the top. Thinking about the fourth shot, would it be helpful for people to understand what their level of immunity is and what threshold it makes sense to boost or delay a booster? Can you tell us a little bit about if these individuals should be getting a booster?
Yeah, this is it's a little complicated because they're having kind of longer term, I don't know how old they are, their longer term side effects. I mean, it's a little bit, that's an unusual type reaction. So this is a decision between the doctor and the patient. So they have a doctor, obviously, and they can make up their mind. And if they're younger people, it's for severe disease and hospitalization, and the fact that they've already had at least their first 2 shots, they're not going to do badly. So it's not an urgent thing. They're not 80 years old with heart disease and some lung disease. It's a very different situation in those people. So there's nothing urgent about what they need to do with those kids. And it should be the doctor-patient decision what's going to happen. There's also going to be new vaccines out. Novavax is going to be out soon, completely different. It's an improvement on the old technology, but kind of still with the older technology. And it does not have the mRNA message thing that turns the cells on. So, that could be another option when that becomes available. It's supposed to be soon. It's already approved in Australia and a few other countries.
Well, that's wonderful to hear. And now for our second COVID question. If you had the original Omicron variant, BA1, do you have immunity against the new Omicron variant, BA2?
We think so. We'll find out shortly if we start seeing recurrent cases. What happened with Delta is we had people who got Delta in December, and then they got Omicron like a couple of weeks later in January. I mean, that was like, wow. You're supposed to have 3 months of infection free.
Right.
So that was not the case with Omicron. Omicron just ran over those. But if you have Omicron, you're probably good for at least 3 months, maybe even longer.
Well, that's wonderful to hear. And now for our third COVID question. I had all 3 Pfizer vaccines with my booster October 2021. I work in dental setting. What's the latest on whether I'm still protected? I'm coming up on 6 months since booster, and I'm sure my protection is decreasing. What do you think about the situation?
Well, so a high risk exposure type person like this, working in the oral cavity where, this is how this thing spreads.
Right.
They're certainly high risk. So I don't know the age of this person or if they have any underlying conditions or not, but if they're eligible for that second booster, they should take it.
Wonderful. And now those were all of our COVID questions for today. Thank you, Dr. Murphy, and we hope that you feel better.
Give me a couple more days. All right, thank you.